Hello, I'm Joe Connolly of WCBS with Dr. Imran Ali of Mount Sinai Healthcare, who has become well known for the understandable and interesting way in which he explains all of the latest important developments in medicine and healthcare. Dr. Ali, there's a worrisome report this week about more cases of cancer in younger people from their 20s into their early 50s. Do we know what is going on here?
Yes, Joe, it is very concerning. We are indeed seeing a lot more gastrointestinal cancers in younger people. In fact, the United States Preventative Task Force has reduced the screening age for colonoscopy from 50 down to 45, just to capture more of these cancers at an earlier stage.
But the colonoscopies do catch it?
Certainly they do. In fact, it can save lives because you can catch the tumor at a very early stage. In fact, early before it spreads to any parts of the body, and it can be removed during the colonoscopy procedure, and you can never have the tumor return as long as you keep surveillance.
We have reports, and we're seeing more people with masks again, it seems, about long COVID, and COVID is still here. What is the status and situation with COVID now?
So I'm glad you asked this question because a lot of people have really been relaxed now since the COVID pandemic. The throes of the pandemic has definitely subsided. We're not at where we were back in 2020, for sure. We're still seeing COVID quite prevalent. In fact, the CDC just this week has been noticing a rise in emergency room visits with coronavirus-related illnesses, especially in our older population and those with already, significant illnesses like cancer or who are on chronic steroids. Because we are seeing a rise in a new variant, the KP3 variant, which is really prevalent.
How concerned should we be about this?
Well, generally, the vaccine has immunity for 4 to 6 months. That being said, the newer vaccine, which is coming out this fall, is going to be more protective against these new variants. The newer vaccine is going to be targeting the JN1 variant, which includes also these new things that we're seeing prevalence in New York City and around the tri-state area, such as KP2 and KP3. Now, all these things may sound very confusing, but these are just different flavors of the same COVID virus. It just tells us that there's a new flavor of it, and we know so far that they're not more transmissible or more virulent, but just a little bit different from what we've been seeing in the past.
On another issue, I think of interest and importance to many people, we have seen the obvious decline and aging of President Biden in a very public way. What does that show us about aging in ourselves and in aging of members of our families?
We have to really get ready for an aging population. The baby boomers are aging every year. We're going to see more and more people up to 2030 become, what we call senior citizens. And, it's very hard to define aging as one universal thing. Everybody is different. I try to stress the difference between a chronological age, the age, that's on your driver's license, and a physiological age. So a physiological age meaning how robust your body is or resilient your body is.
Does that mean fitness? Does fitness slow aging, do you believe?
Well, yes, and it's very hard, and scientists are working around the clock to figure out how aging actually works. At the scientific level, we can now define frailty as not just how weak a person looks, but how their body is functioning, not only from a muscular strength, cognitive ability, but down even to the individual cell. We have researchers at Albert Einstein University who are unlocking, how our cells age at the individual level. And it's very fascinating.
What are they finding?
What we're learning is that, the metabolism of each cell is different in each person. And that's why in Boston, we are actually, sequencing genes of what we call super agers or super centenarians. We're seeing more people age beyond 105.
Healthily.
Healthily, functionally. I have personally treated patients up to age 109, and it's remarkable. And we can credit that to better sanitation, better public health, but also advances in general preventative care.
Is there one sign that people should look for, especially in their parents and grandparents, that should raise a question about their situation and they should start to watch it more closely? Is there a single sign?
There actually is. Scientifically, we measure something called gait speed, or how fast an individual can walk at their normal pace for a short distance. And that's what we measure now in our geriatrics clinics. Gait speed is the most highly correlated marker of physical fitness, and it's used all around in geriatrics. I use it in my cancer patients as well.
Isn't that interesting? I've never heard that. I've never heard
Because
that.
if you think about it, when we're walking, we're engaging several parts of our physical strength, our eye-hand coordination, our sensory faculties of vision, hearing, balance. So that one little test can tell us a lot about a person's physical fitness.
We hear a lot about the problems being caused by the shortage of healthcare professionals. Is this true? Is there a shortage?
It truly is. And we're still, when it comes to at least a long-term care, where we're needing more people to help, meet the needs of an aging population, we're not even anywhere near pre-COVID levels. In fact, we have lost so many direct care workers. What we call direct care workers are those who really assist in the day-to-day tasks of our residents in a nursing home. And I think we really need to do much better in hiring and retaining more direct care workers.
And training them in community colleges or wherever.
Absolutely. And also, there's a push by many people to increase the pay of these direct care workers. And, I know the Biden administration has been pushing a staffing mandate. And this has been a very controversial topic because it's actually, going to put a lot of rural nursing homes out of business because they just can't hire or afford to hire more staff. So I think there's going to have to be some impact from the federal government to meet the needs of our aging population when it comes especially to long-term care.
From what you see every single day, what are one or two of the things that you think should be done to bring down the cost of health care?
I think we do too much. We do too many fancy things. We order too many CT scans. We do too many, needless procedures that actually have a high risk but low benefit. So I often talk to the people who I'm training. I ask them, well, you're going to order this fancy MRI. What are you going to do with the results? How is that going to change what you're going to do for the patient?
Is it just nice to know? Does it make any difference, right? That's
Right,
what you're asking?
exactly. And
if it's just nice to know, you may not need it.
We don't need it. Also, you got to think about it. Sometimes doing less is more. And when it comes to, taking care of older adults, geriatrics, the first thing we look at is all these medications. People come to my clinic with a shopping bag full of medications, what we call polypharmacy. All these medications cause drug interactions, and the body metabolizes drugs differently as we age. So a lot of the problems can be solved just by getting rid of needless medications.
In what areas, just a couple of other questions, in what areas do you see the most hope and the most advances in medicine being made?
I think really what's very interesting now is wearable technology. I would never thought that would be the next phase, especially for older adults who everybody erroneously thinks that they're not tech savvy. In fact, they're very tech savvy. We can monitor falls remotely. We can even do cognitive testing on a phone, an app that's easy to use. We've actually trained Alexa to help remind patients of taking their medications. We can monitor heart rate, other vital signs easily from the use of a watch. And my older adults love it.
Why? What is the importance to you the doctor of having someone on a watch like
Because I
that?
take care of a lot of patients, older adults with cancer. So after they get a heavy dose of chemotherapy and I send them home, we want to know what that medication, what the chemotherapy is doing to them. Are they feeling more nauseous? Is it affecting their heart rate? Is it increasing their risk of falls? We can measure all of those things with the sensors on an Apple Watch, for example.
And you can see that in your office
We can
without
see
having
that
them
on
in
a
the office,
dashboard.
and then you call them up.
Yes, because it eliminates that extra burden of traveling to the doctor's office.
Will we, sometime in the next 10 or 15 years, see the announcement of a cure for cancer or a cure for Alzheimer's?
Well, I got to say one thing. This has been the best 2 years when it comes to Alzheimer's type dementia. We are seeing amazing research, not only in diagnostics, diagnosing Alzheimer's much early. We used to use, a spinal tap to look at the cerebrospinal fluid, which is a nasty procedure, and we thought that was a breakthrough. Now we know that there's a new biomarker-based blood test that can measure what we call amyloid plaques. These are the actual plaques that we know are seen in Alzheimer's patients, which can interfere with the brain's ability to communicate with different parts of the brain. We can do it now via a blood test, which is now, as of last week, in a recent study, shows over 90% positive results in predicting accurately early Alzheimer's.
And finally, Dr. Ali, why do you add time to your schedule to talk to the media about healthcare and medicine?
Frankly, Joe, because there's information overload. By my desk, I see study after study after study come in with so many conflicting things, and patients now are very savvy. They want to understand what's going on with their own health, and they go onto the internet, they go onto YouTube, and they get so much information. Some of it is good, but almost 70% of it is really, really bad. And it actually causes more anxiety. And I find it that in medicine, we are really rushed to see a lot of patients in a short period of time. So the average office visits last maybe 15, maybe 18, 20 minutes. People come in with note cards of questions they've been saving up. I like to take the time to explain things in simple terms, and if I can reach an audience of 30,000 people in a 30-second package, that means much more than just reaching one person in a 15-minute office visit.
Your patients are very fortunate to
Thank
have
you.
a doctor who, with your knowledge, who takes time to explain things to them understandably. Thank you very much,
Thank
Dr.
you.
Ali.
Thank you very much.